name is Carolyn Savant. I'm the medical assistant instructor. And today we're going to go over the procedure 42-9, which is responding to a patient with syncope. We're not going to have her lay on the floor. But if someone did have a syncopal episode, which is they faint. That's all that syncope means, is they fainted. So we had gotten her up off the floor, we placed her on the table. Whenever you're identifying your signs of syncope, the person is breathing, their heart is beating, but they are not responsive. This episode lasted just a few seconds. We were able to get her up onto the table. Now we're going to go over what we would do next. We always want to get at blood pressure. So I will raise her sleeve up, because you want to find out what caused the syncope episode. You want to make sure that it was not that her blood pressure was too high. You want to make sure that it was not something else. Your blood pressure is good. It is 134/82, so we know that it is not due to elevated blood pressure. Next, I would get her pulse and respirations. Okay. Her respirations are 20, her pulse is 78. So her vital signs are within normal limits at this time. The other thing that you would want to do is a neurological check. We get started working with pen lights in the lab. But here you're simply wanting to look at the pupil to see how the pupil is reacting. Just stare straight ahead, please. You notice I turn the light on and then I bring it over the eye, and I do not just leave it. Turn it on, bring it over, and remove it. Turn it on, bring it over, and remove it. You're wanting to see how the pupils are reacting. Naturally, when you shine the light in it, the pupil should contract. So you're looking to see, are the pupils contracting equally? If you have a pupil that whenever you're shining the light in it, the pupil does not contract, then you know that there's a problem. That is something that you would notify the doctor of. The other thing that you would want to make sure of, you start asking them questions. Did you notice anything before you fainted? Did you have a headache? Did you see lights? Did you have trouble with your vision? These are all questions that you want to ask. Knowing what they respond can tell you how you're going to document. Sometimes before someone faints, they may notice their vision getting very blurry. They may have a sudden sharp pain in the head. They may have dizziness, lightheadedness. This does not always happen though. There are some times when people simply faint or have a syncope episode. There is also a diagnosis that is called pre-syncope. That means that the patient did not actually lose consciousness. Pre-syncope is whenever you simply get so dizzy and lightheaded and you have to stand holding up, you have to sit down, you get really weak. Instead of just listing it as lightheaded, which is what you would, as a medical assistant, would do, you would list the symptoms that they describe. I was lightheaded, I got flushed, I got hot, my vision got all blurry and I couldn't see straight. This is what you would document and list, because you as a medical assistant cannot make a diagnosis. So you list what actually happened and document what happened. How are you feeling now? You want to make sure, because before I would let her stand up, I want to make sure that all symptoms are resolved, that she is not feeling dizzy, she is not feeling lightheaded. Are you feeling weak, dizzy? Do you feel like you can stand up?
Yes.
I would have the patient stand up, but then I would have her just stand here for a moment. I want to make sure that whenever she went from a sitting to a standing, that she does not get dizzy, lightheaded, or anything like that. Because you want to make sure that the person is stable before you allow them to leave your room. Do you feel okay?
Yes.
No problems with your vision? No headaches, no pain anywhere?
No.
When you fell, do you have any pain from that? Did you hit your hip, your knee? Any pain from the fall itself?
No, ma'am.
These are all things that you would want to document. When they fell, they hit their right knee. Notice red discoloration, whatever the case may be. But you want to make your documentation as full as possible. Not only about the episode itself, but about any harm that they could have done to themselves when they fell. So now that we have our patient ready, she's already seen the doctor, she is now free to be leaving. Thank you. But your job as a medical assistant is not done. As we had discussed earlier in our labs, your job now will be to clean. You notice that I have not put my stethoscope around my neck the way I normally would carry it. I still have it hanging down because I have not cleaned my stethoscope yet. So I would take my wipes and I start out with my personal area closest to me first, which is to clean my stethoscope, both sides. Clean it back up. Anything that could have come in contact with the patient. Now, I can flip it like I normally carry my stethoscope. The other thing that I will be cleaning is my blood pressure cuff that I had up against her skin. You always want to clean. Okay, now I can safely fold up my blood pressure cuff and I have it ready for the next time. But my exam room. You want to make sure that everything that was up on the bed from before is completely done. And I also mess this up. Some of the offices, this is sufficient. In my class, this will not be sufficient, but I showed you this way because this is what you will commonly see, and it's okay in some medical offices because this is what they practice. But for here in our class, we do not simply do paper. For our class, the way that I'm going to be grading you is that between every patient, you actually wipe down your bed. Again, you may get out into the field and they do not want you taking the time to do this. They may just want you to do the paper. That is fine. If that is what your clinic tells you to do, that is what your site says, that is what you do. But if they do not tell you otherwise, then you disinfect the whole table. Once you have disinfected, you know you have to leave that surface, which is why some clinics do not do this step this way. They do it at the end of the day, they'll do it at the lunch. They will fully disinfect the table only 2 to 3 times a day. But regardless, you will always have changed your paper. And you would have fresh paper before your next patient comes in. If there would have been anywhere else in here, if they would have been sitting in the chair, I would now disinfect that chair. Wherever the patient was, you have to disinfect. As far as I know, I was dealing with a perfectly healthy patient who simply had a faint, a syncope episode. But I do not know this. So you have to treat every patient as if they are contagious. And you don't know what it is. Disinfect, make sure that you wear your PPE, always have your gloves on, change your gloves, disinfect your equipment. And if y'all have any questions, just let me know. Thank you.